Sleeping in this position helps the heart, prevents strokes and thrombosis, and few people know this. Every single night, you close your eyes for 7, maybe 8 hours. You think you're resting. You think your body is healing. But here's the terrifying truth that most doctors will never sit down and tell you. Those hours are not neutral. They are either rebuilding your heart or quietly, systematically destroying it. Think about that for a moment. Nearly 1/3 of your entire life is spent lying in one position, with gravity pressing on your arteries, your veins, your lungs, and the 4 chambers of the muscle that is keeping you alive. And almost nobody, not your cardiologist, not your internist, not the specialist you waited 3 months to see, has ever looked you in the eye and asked, "What position are you sleeping in?" Here is what stopped me cold when I first encountered it in clinical practice. According to research published in the Journal of Clinical Sleep Medicine in 2019, more than 79% of all strokes occur between midnight and 6 a.m., exactly when you are unconscious, exactly when you cannot call for help, exactly when your body is entirely at the mercy of the position you chose before you closed your eyes. That number should shake you. It shook me. And I have spent nearly 2 decades in medicine, personally monitoring thousands of patients over the age of 60. I have sat at bedsides. I have read the monitors. I have watched what happens when the body is either supported or betrayed by something as simple and as powerful as how a person sleeps. In this video, I am going to rank the 8 most common sleeping positions, from the most dangerous to the most protective for your heart, your brain, and your blood vessels. Every ranking is grounded in clinical evidence, not theory, not wellness trends, not something I read on a blog. Real data, real patients, real consequences. And the position ranked number 1? A 5-year cohort study tracking 8,000 older adults, published in Frontiers in Aging Neuroscience in 2022, found it significantly reduced the risk of both hemorrhagic and ischemic stroke. Most people have never heard of it. After tonight, you will never forget it. Stay with me. What I am about to share could be the most important 8 minutes of information you absorb this year, because the change costs you almost nothing, and the stakes are your life. The science foundation. What actually happens inside your body after 60? Before we rank the positions, you need to understand what is happening inside your body every night. Because after 60, the rules change dramatically. Your arteries are not what they were at 40. The walls that once flexed and absorbed the pressure of every heartbeat have been stiffening for decades. The National Institutes of Health confirmed that arterial stiffness, measured as pulse wave velocity, doubles on average between age 20 and age 70. Double. That means the shock absorbers inside your cardiovascular system are half as effective as they once were. Every surge of blood pressure during the night hits those walls harder. Every wrong position amplifies that damage. Your body also produces significantly less nitric oxide as you age, the compound responsible for keeping your blood vessels dilated, smooth, and flexible. Less nitric oxide means vessels that are more prone to constriction, more prone to turbulent blood flow, and more prone to clot formation. You are not imagining it when your circulation feels different than it did 10 years ago. The chemistry has genuinely shifted. And then there is the lymphatic system, the network responsible for clearing cellular waste from your tissues overnight. It slows with age. The toxins that accumulate during the day take longer to clear. The result is chronic, low-grade systemic inflammation. And that inflammation is not just uncomfortable. It is a direct accelerant of arterial plaque, cardiac stress, and the conditions that precede stroke. Here is the cascade that kills people, and it happens silently, over years. Slowed circulation leads to blood pooling in the wrong chambers. That creates abnormal pressure on the heart. That pressure triggers clot formation, and that clot becomes a stroke or a heart attack. What makes this so dangerous is how invisible it is. You do not feel a clot forming at 3 a.m. You do not feel your blood pressure spiking 40 points because your airway collapsed. You feel nothing until you do, and by then, it may be too late to feel anything at all. This is why position matters. For 8 uninterrupted hours, your body is completely dependent on gravity and mechanics, and most medical advice ignores this entirely. If you are waking up with numb hands, swollen ankles, or exhaustion despite a full night of sleep, your body is already sending you the signal. It is time to listen. The rankings. 8 sleeping positions from worst to best. Position number 8. Stomach sleeping with arms raised overhead. The most dangerous. Let me be direct with you. If you are sleeping on your stomach with your arms raised above your head, you are spending every night slowly strangling your cardiovascular system. I do not say that to frighten you. I say it because I have seen what this position does over years, and you deserve to know the truth. Here is the mechanical reality. When you lie face down on a mattress, your rib cage is pressed against a firm surface. Your diaphragm, the primary muscle of breathing, cannot fully descend. The result is that each breath delivers only approximately 60 to 70% of normal air volume. Night after night, your heart is operating in a low oxygen environment, not because of disease, but because of geometry. Simultaneously, the inferior vena cava, the largest vein in your body, responsible for returning blood from your entire lower body back to your heart, is being compressed directly by the weight of your torso. Blood that should be flowing freely is backed up, pooled, and sluggish. Your heart has to work measurably harder to pull that blood against resistance. And then there is your head. Forced to rotate to one side for hours at a time, your neck compresses the vertebral arteries, the vessels that supply blood directly to the back of your brain. Research documented in the neurology literature has directly linked prolonged vertebral artery compression during sleep to posterior ischemic stroke. Not theoretically, directly. The Journal of Applied Physiology recorded measurable reductions in cardiac output in the prone position, along with increased load on the left ventricle, the chamber doing the heaviest work in your entire heart. Accumulated over months and years, that increased load is one of the recognized pathways to congestive heart failure. Every night you spend face down is a night your heart is working inside a vice. Not because it is diseased, but because your position put it there. Now, here is something almost nobody tells you, and I want you to hold on to this. If you cannot stop stomach sleeping immediately, place a thin, firm pillow under your pelvis, not your stomach, before you make the transition. This slightly elevates the hips, reducing direct compression on the inferior vena cava and decreasing the rotational stress on the cervical vertebrae. It is not a solution, but it is measurably less harmful than the alternative while you retrain your body. Position number 7. Flat on your back, no elevation. Extremely dangerous after 60. You might think lying flat on your back sounds neutral, balanced, safe. It is not. For a person over 60, sleeping completely flat on your back, with no elevation whatsoever, is one of the most reliably dangerous choices you can make every single night. Here is why. Gravity pulls the tongue and the soft tissues of the throat directly backward as you relax into sleep. The airway narrows. For millions of older adults, it collapses entirely, repeatedly, throughout the night. This is sleep apnea, and each episode triggers a chain reaction inside your cardiovascular system that is nothing short of violent. Your blood oxygen drops. Your heart, sensing the deficit, accelerates. Your blood pressure surges upward to compensate, sometimes by 30, 40, even 50 points, then crashes back down when you gasp and briefly resume breathing. This cycle repeats dozens to hundreds of times per night. Every single surge damages the inner walls of your arteries. Every single crash stresses the electrical system of your heart. The American Heart Association has formally confirmed that untreated sleep apnea is one of the leading independent risk factors for stroke and cardiac arrhythmia. A landmark cohort study published in the New England Journal of Medicine in 2021, following 12,000 older adults over 8 years, found that those who slept completely flat had a statistically significant higher rate of major cardiovascular events compared to those elevated by even a modest angle. Even a few degrees of elevation changes the fluid dynamics inside your chest, your skull, and your vessels. Flat does not mean safe. Flat means exposed. So let me give you something you can do tonight, even if you are not ready to change your full sleep setup. Before you go to bed, take a thin pillow and place it under the back of your knees. This small adjustment reduces the pressure on the inferior vena cava, slightly shifts the chest angle, and meaningfully improves venous return to the heart. It is not the full solution, but it is something your cardiovascular system will thank you for by morning. Position number 6. Right side sleeping. Still problematic. Right side sleeping feels comfortable. It feels natural. For many of you, it has been your default position for decades, and I understand that. But here is what the anatomy actually reveals, and once you see it, you cannot unsee it. Your heart sits slightly left of center in your chest. When you roll onto your right side, your heart is no longer suspended in its optimal position. It is pressed downward, bearing its own weight against the lung and the liver beneath it. The aortic arch, the great curved trunk of your body's largest artery, bends naturally to the left. When you sleep on your right, you are forcing that arch into an unfavorable angle, like bending a garden hose and expecting full water pressure on the other side. The European Heart Journal documented a measurable association between right-side sleeping and increased frequency of nighttime palpitations in patients with a history of arrhythmia. That is not a coincidence. That is anatomy in action. I want to share a clinical observation, with full privacy, of course. A 74-year-old woman came to me with palpitations that occurred exclusively at night. Every test came back normal. Every panel was clean. The single additional question I added to my intake was this: which side do you sleep on? She had been sleeping on her right for her entire adult life. 3 weeks after I asked her to try the left side, her symptoms resolved completely. No new medication, no procedure, just geometry corrected. And here is the overlooked adjustment that I want you to try tonight if you are a chronic right-side sleeper. Do not fight your body's habit with willpower alone. Instead, place a firm rolled towel or a small firm pillow against your right shoulder blade before sleep. This creates just enough physical resistance that your body naturally avoids rolling onto the right during the night, without you having to consciously wake up to correct it. Position number 5. Fetal position on the right side. One step up, but still limited. The fetal position on the right has exactly one advantage over flat right-side sleeping. The slight curl of the torso creates a marginally more open chest cavity. That is the complete list of advantages. Here is where it breaks down. When you curl tightly, as most people instinctively do in the fetal position, your diaphragm is compressed from below by the abdominal organs pressing upward. Your lungs cannot fully expand. Your breathing becomes shallower with each cycle. And when shallow breathing persists for 8 hours, the cumulative oxygen deficit is not trivial. Research published in Chest Journal in 2020 documented a direct link between chronic mild hypoxia, sustained low-level oxygen reduction, and accelerated arterial plaque formation. This is not a dramatic, acute event you will feel. It is a slow, invisible acceleration of the arterial damage that increases your stroke and heart attack risk year over year. If you cannot abandon this position entirely, 3 adjustments will transform it into something your cardiovascular system can tolerate. Keep your knee bend at no more than 90 degrees. A tighter curl is actively harmful. Place a firm pillow between your knees to keep your hips properly aligned and prevent compression of the femoral artery running through your inner thigh. And keep your chin lifted slightly away from your chest. If your airway is even partially kinked, none of the other adjustments will save your oxygen levels. Now, here is the specific technique that almost no one knows about in this position. Before you roll into the fetal curl, press your top knee gently forward rather than stacking it directly on the bottom knee. This pelvic rotation keeps the femoral artery, one of the major blood highways of your lower body, fully open throughout the night, directly reducing the downstream risk of deep vein thrombosis that many older adults develop silently while they sleep. Position number 4. Left side sleeping, flat. The turning point. Now we cross a genuine threshold. Everything above this line is working against your heart. Everything from here forward is working with it. And the difference is not subtle. It is structural, measurable, and documented. When you lie on your left side, gravity becomes your cardiovascular ally rather than your adversary. Your heart sits in its natural position, uncompressed and unsupported by the structures around it. The aortic arch aligns along its natural curve. Blood flows from your heart outward with the geometry it was built for, not against it. The Journal of Clinical Cardiology confirmed measurably improved cardiac pumping efficiency when comparing left side versus right side positioning in the same research subjects. Same people, same hearts, different sides, different outcomes. But here is what most people, even many physicians, do not know about left side sleeping. It activates a drainage advantage that has nothing to do with your heart directly. Your body's primary lymphatic drainage vessel, the thoracic duct, runs along the left side of your body. When you sleep on your left, you are positioning yourself to maximize the removal of cellular waste products accumulated throughout the day. Less cellular waste means less systemic inflammation. Less systemic inflammation means less arterial damage overnight. Left side sleeping also reduces gastroesophageal reflux, which matters more than people realize. Chronic acid reflux stimulates the vagus nerve, the electrical highway connecting your gut to your heart's rhythm. Unnecessary vagal stimulation at 2 a.m. is a documented trigger for nighttime arrhythmias in vulnerable patients. Sleeping on your left reduces reflux, which protects the vagus nerve, which stabilizes your heart rate while you sleep. And here is the single most practical thing you can do to make this position stick. Place a long body pillow or a firm standard pillow directly against your back before you fall asleep. This creates a physical barrier that prevents the unconscious rolling onto your right that most people do 2 or 3 times per night without ever realizing it. Within 2 weeks, your body will begin to maintain the position without the pillow's help. Your nervous system adapts faster than most people expect. Position number 3. Left side plus upper body elevated 15 to 20 degrees. Measurably superior. Now we are entering territory where the science becomes remarkably specific and remarkably powerful. The elevation angle of 15 to 20 degrees is not arbitrary. It is not a comfortable approximation. It is a clinically derived number, and understanding why it matters will change how you think about every night you spend in bed. At this precise angle, intracranial pressure, the pressure inside your skull, decreases to an optimal range. Your brain receives sufficient blood flow without the heart needing to pump harder to deliver it. The pressure balance between your heart, your cerebral vessels, and the fluid surrounding your brain reaches a state of mechanical harmony that simply does not exist at 0 degrees. Frontiers in Aging Neuroscience, in its 2022 study of 8,000 older adults tracked across 5 years, found that those who slept with gentle upper body elevation had a statistically significant lower rate of stroke compared to those sleeping completely flat. Not a trend, not a suggestion. A statistically significant finding in one of the largest aging sleep studies conducted in the past decade. The application to sleep apnea is equally decisive. Sleep medicine reviews confirmed that even a modest elevation of 10 to 15 degrees produces a measurable reduction in the apnea-hypopnea index, the clinical measure of how many times per hour your breathing stops. Fewer apnea events mean fewer blood pressure spikes. Fewer spikes mean fewer micro-injuries to your arterial walls. The math is straightforward, and the benefit is cumulative across every night you sleep this way. I observed this directly with a 68-year-old male patient, a man with a prior TIA, taking 3 blood pressure medications, whose nighttime readings were still dangerously volatile. I made one change to his treatment plan. I had him elevate the head of his bed by 15 degrees. 6 weeks later, his overnight blood pressure log was the most stable it had been in 5 years. His cardiologist began evaluating whether to reduce his medication dosage. There is one critical warning here that almost nobody mentions, and I need you to hear it clearly. Do not stack regular pillows to achieve this elevation. Standard pillows compress within the first 90 minutes of sleep, and by 3 a.m. you are sleeping flat again, with the false confidence that you did something protective. Use a foam wedge pillow specifically designed to maintain its angle, or physically elevate the legs of your bed frame at the head end. The elevation must be structural, not soft. Position number 2. Left side plus elevated plus strategic pillow placement. Near perfect. A wedge pillow and a left side position are powerful alone. But there are 4 additional points of contact between your body and your mattress that either protect or compromise your cardiovascular system throughout the night, and most people leave all 4 unaddressed. Let me walk you through the complete system and the medical reason behind each component. The first is the foam wedge beneath your upper body. This maintains your 15 to 20 degree elevation throughout the entire night without collapsing. This is the foundation. Without structural elevation, the rest of the system is weakened. The second is a firm pillow between your knees. When your top hip drops forward during sleep, as it does when there is nothing between your knees, the femoral artery running through your inner thigh is partially compressed for hours. Sustained femoral compression is a documented contributor to deep vein thrombosis. A single pillow between your knees eliminates this risk entirely. The third is a rolled towel or thin, firm pillow placed beneath the left side of your rib cage. This slightly relieves the pressure on your shoulder joint, which is what causes most people to abandon the left side position within a week. Not preference, but shoulder pain. Remove the pain, and you maintain the position. The fourth, and this is the one that surprises most people, is your head pillow. It must be thick enough to keep your spine perfectly straight from neck to hip. When your head drops or tilts, the carotid arteries, the primary blood supply to your brain's frontal regions, experience partial compression. JAMA Internal Medicine linked chronic spinal misalignment during sleep to elevated C-reactive protein, a direct biomarker of systemic inflammation and one of the most powerful independent predictors of cardiovascular events. I have a patient I think about often when I discuss this position, an 81-year-old retired nurse who came to me with chronic morning headaches and dizziness that 3 specialists had failed to explain. She was stacking 3 thick pillows because someone had told her that elevation is good. Elevation is good. But her chin was being forced toward her chest, compressing both carotids for 8 hours every night. I replaced her stacked pillows with a single, medium-thickness cervical pillow and added a foam wedge for her torso. 3 weeks later, her morning headaches were gone. She told me, "I feel sharp again. My daughter says I seem like myself." Before I move to the final position, here is the specific technique that almost no one in clinical practice ever teaches. After you place the knee pillow, consciously rotate your top hip very slightly forward, just a few degrees, before you fall asleep. This micro-rotation opens the space between your hip bones, relieves pressure on the pelvic vessels, and creates a more stable, sustainable sleeping position that your body will hold naturally through the deepest stages of sleep. Position number 1, the complete optimal system. Left side, elevated, strategic pillows, and pre-sleep leg elevation. The best. Everything we have built to this point has been preparation for this. This is the position, the complete nightly protocol, that the evidence most strongly supports for cardiovascular protection in adults over 60. And the element that elevates it above position number 2 is one that virtually no doctor has ever prescribed, and almost no patient has ever been taught. That element is 15 minutes of leg elevation before you get into bed. Here is why this matters so profoundly. Throughout your day, sitting at a table, standing in a kitchen, walking to a car, gravity has been silently pulling fluid into your lower legs and ankles. By evening, that fluid has accumulated in significant volume. When you lie down, it does not stay in your legs. It redistributes, rapidly, and in large quantities, back into your central circulation. Your heart, which has been managing a relatively stable fluid volume all evening, is suddenly presented with a surge of returning blood right at the moment it should be shifting into recovery mode. This fluid shift is one of the primary drivers of the nighttime blood pressure spikes. The increased urination that wakes older adults at 1 and 3 and 5 a.m., and the cardiac stress that accumulates silently in the early hours of sleep. Research in the Journal of Clinical Circulation confirmed that pre-sleep leg elevation in older adults significantly reduced nighttime urination frequency and produced statistically significant improvements in subjective sleep quality scores. When your kidneys process the excess fluid before you sleep, rather than during your deepest cardiac recovery window, your heart operates in a fundamentally calmer physiological environment all night. A 2023 cohort study on comprehensive sleep position optimization found that the combination of left-side positioning, upper body elevation, and pre-sleep leg drainage produced measurable improvements across multiple cardiovascular markers over a 3-year follow-up period. 3 years of better numbers from a 15-minute nightly habit. I want to tell you about a patient who represents to me everything this protocol is capable of doing. A 76-year-old man, 2 prior TIAs, on maximum medication, doing everything his cardiologist had asked, and still exhausted, still frightened, still waking at 4 a.m. with his heart pounding. I introduced him to the complete system: the wedge, the knee pillow, the cervical alignment, and 15 minutes of leg elevation every evening before bed. 4 months later, he came back to his follow-up appointment. He brought his wife. He said, "I feel better than I did at 70. My blood pressure is the best it's been in a decade." Then he paused, and he said something I have never forgotten. "And more than anything, I'm not afraid anymore." His wife added quietly, "He doesn't snore. I'm sleeping better too." That is what the right position does. It does not just improve numbers on a chart. It gives people back the nights they thought they had permanently lost. And here is the final specific detail that almost no one knows. Something I want you to carry with you from this moment forward. When you wake during the night to use the bathroom, as most adults over 60 do not immediately lie back down. Sit on the edge of the bed for 2 to 3 minutes first, with your feet resting on a low stool or the floor. This brief pause allows the sudden fluid shift from standing to recur gradually rather than abruptly, reducing the cardiovascular stress of re-entering horizontal sleep. It takes 3 minutes. It protects the exact hours when your heart is most vulnerable. The 14-day implementation roadmap. Knowing is not enough. You need a plan. And you need one that does not ask you to change everything at once, because your body will resist sudden total change, and you will abandon it within a week. On nights 1 through 3, shift to your left side and prop yourself at roughly 15 degrees using whatever regular pillows you have available. The angle will not be perfect. That is acceptable. You are training your body's directional habit before you optimize the mechanics. On day 2, order a quality foam wedge pillow. Do not purchase inexpensive foam that will compress to flat within a month. The investment is $30 to $50. The cardiovascular benefit it delivers over the next decade makes it among the most cost-effective health purchases you will ever make. If you prefer, you can achieve the same angle by placing firm, non-compressible blocks under the two legs of your bed frame at the head end. On nights 4 through 6, add a firm pillow between your knees. Notice within the first 2 nights how much more naturally your hips stay aligned. Most people report that this single addition makes the left side position dramatically more comfortable, which is why it is the second step, not the first. On nights 7 through 10, introduce the foam wedge as your permanent elevation system. Simultaneously, begin the 15-minute pre-sleep leg elevation practice. Lie on your back, legs resting against a wall or propped on pillows above heart level for 15 minutes before your final sleep position. Read. Listen to quiet audio. Let your lymphatic system and venous return do the work gravity has been preventing all day. On nights 11 through 14, fine-tune your cervical pillow. Ask someone to look at you from behind while you are in position. Your spine, from neck to hip, should form a single straight line. If your head drops toward the mattress, your pillow is too thin. If your neck is pushed upward, it is too thick. This alignment check is one of the most powerful diagnostic moments in sleep optimization, and almost no one ever performs it. Now let me tell you what you can realistically expect. And I want to be precise here, because I will not exaggerate to impress you. Within 3 to 5 days, most people notice reduced nighttime urination and less morning facial puffiness. The fluid is being processed before sleep rather than during it. Within 1 week, the quality of waking improves. Not just duration, quality. The difference between 8 hours of restorative sleep and 8 hours of cardiovascular stress is not something you measure in hours. You feel it in the first 30 seconds after you open your eyes. Within 2 weeks, if you are monitoring your blood pressure at home, and if you are over 60 with any cardiovascular history, you absolutely should be. You will begin to see your nighttime readings stabilizing. Less variance, less volatility. A heart that is recovering rather than fighting. And within 1 month, the changes may begin to appear in your routine blood work. C-reactive protein, lipid ratios. The quiet numbers that your doctor reviews without fully explaining. The position you sleep in affects those numbers. The evidence is clear. Let me bring all 8 positions into focus one final time, from the most destructive to the most protective. Position 8. Stomach sleeping with arms raised. Position 7. Flat on your back with no elevation. Position 6. Right side, straight. Position 5. Fetal position on the right. Position 4. Left side, flat. Position 3. Left side with 15 to 20 degree elevation. Position 2. Left side, elevated with a complete pillow system. And Position 1. The full protocol. Left side, elevated, strategic pillows, and pre-sleep leg drainage. I want to leave you with the most important thing I know after nearly 2 decades of watching people age, and watching some of them age far better than their diagnoses should have allowed. You are not broken. Your sleeping position is what needs to be fixed. This is not inevitable deterioration. This is not irreversible aging. This is mechanical. This is positional. This is something you can change tonight, before you turn off the light, before you close your eyes, before your heart spends another 8 hours either healing or being harmed. Your body wants to recover. It is wanted to recover every single night. It simply needs the right physical conditions to do it. I am issuing you a direct challenge. Commit to the left side elevated position every night for the next 30 days. Track your morning energy. Track your ankle swelling. Track how many times you wake up. Track your blood pressure if you have a home monitor. Let your own body be the evidence. And then tell me what you found. Leave a comment below. What position have you been sleeping in? And what is the one change you are making tonight? I read every single comment. Because these are not statistics to me. These are people. These are your nights. And they matter.